near 80 and the low near 60. Those showers and thunderstorms will stick around for Saturday, partly to mostly cloudy in the mid to upper 70s. And more showers and thunderstorms Saturday night. Then we dry out just a little bit on Sunday, partly to mostly sunny in the low 80s. Jonesboro's community radio station, we're KLEK 102.5 FM.
From Feature Story News in London, I'm Ollie Barrett. Hundreds of people have been evacuated from a residential area on Hawaii's largest island after Mount Kilauea volcano erupted. No Nobel Prize for Literature will be handed out this year as the organisation that picks the award deals with a sexual assault scandal. And the death toll's risen after dust and thunderstorms hit parts of northern India, with more than 125 people now reported to have lost their lives.
It's 9:01.
Community Conversations is brought to you by Arkansas Early Learning, offering no-cost childcare in Jonesboro and Northeast Arkansas. Applications at arearlylearning.org.
Arkansas Early Learning is a nonprofit organization.
KLEK LP Jonesboro, the voice of Arkansas Minority Advocacy Council. It's now time for Community Conversations, a program focusing on the people working to make the Jonesboro community a better place, while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK 102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
Good morning, everyone, and happy Friday to you. You're tuned in to Community Conversations on KLEK 102.5 FM. I'm your host, Quabila Jones, and my very special guest is Ms. Karan Summitt from St. Bernard's Healthcare, and she is the navigator of a new program called the Congregational Health Alliance. So thank you for joining us to share this wonderful information about this. I've been looking over the handout and we've been talking a lot off air. So I am really looking forward to her sharing this information with you all. And I really pray that everyone that's listening takes this to heart and share with everyone and encourage your church or youth faith group to apply this to your every day. So let's just get right into it. But before we get into that, I would like for Ms. Karan to please give us some background on herself. How long you've been with St. Bernard's, or how long you've been in the medical field, and what else you may have done.
Okay. Well, thank you, Quabila. My name is Karan Summitt. I've been at St. Bernard's almost 12 years, and during most of that time, I've been a health educator. I've worked in weight loss programs. I've worked with senior citizens and with community, and even with our employees, and just helping them learn the behaviors and practice the behaviors of a healthy lifestyle. My background is actually in education as a family science. We used to call that home ec. So that probably rings a bell with a lot of people, but I love that area and time that I got to spend just talking about family healthy behaviors, which is basically what home economics is. So I've loved my work, because one of the things that I've noticed throughout the years is when you can help people get healthier, whether that's a diet, whether that's addressing some kind of chronic disease, you don't just lower their risk for that disease, you help them get their life back. Wow. And so I've got a lot of stories that I hold dear to my heart about people who were at a place in their health that was very serious, but when we kind of got to a better place, they were able to do so many of the things that they wanted to do. So it's about quality of life as well as quantity of life when we're talking about our health.
I like how you pointed out the quality of life, and have you seen people go from one place to another, a better place. I have a Facebook friend who was diagnosed with congestive heart failure many years ago, and once his doctor told him it was do or die, make changes or you will die, he started making changes, and now he's running marathons. He's, a state advocate for heart disease and other heart awareness issues, and so his life has totally made a turnaround, and he made the choice though. And I know a lot of other people that have dealt with, like you said, chronic illnesses that have made the choice to say, okay, I'm going to make some changes. I apologize.
That's all right.
Okay, so let's go ahead and get right into this program. When did it start, or how did the discussion start the Congregational Health Alliance? Tell us some background about.
Okay, let me do that. I'd love to. Now, we're a new program at St. Bernard's.
Okay.
2018 in January is when I came on board as the first navigator, the only one right now, but we're looking forward to adding more navigators as the program grows. An attempt was made to do the program about 5 years ago, but at that time, the idea was kind of put on the plate of some folks whose plate was already full.
Okay.
This time around, I think we realized it needed to be a full-time effort, for a group. The background of the program is really in our back door with Methodist Healthcare Systems in Memphis, Tennessee.
Okay.
Methodist Healthcare Systems is a lot like St. Bernard's and other hospitals. They do the work they do from the basis of their faith.
Okay.
So if you think about that, a lot of hospitals come out of faith institutions.
Okay.
And one of the things that they realized was they could help people get healthier while they were under their umbrella of care. In the hospital, or maybe through some therapy and programs like that, we could get people stabilized, or they could get people stabilized with their health. But when the people went back out into the community, went back into their homes and just their everyday life, for so many people it was hard to sustain that health. They didn't have the support to do that. The other thing they saw is that when many people showed up for health care, they had a mostly preventable or treatable disease, but it was at an advanced state. So it had really missed a window of opportunity for that disease to be manageable, to be treatable, or even to be cured. So they wanted to do better at this. They wanted to figure out how can we really impact our community and improve the health and see people at the right time, early stages, get these lifestyle behaviors where people can practice them. Well, someone noticed, and I would love to meet this person, but someone noticed on admission forms that 80% of the people admitted to the hospital had been to church at least once in the previous 4 weeks.
Okay.
So I think from there began this idea and a brainstorm that what if we tackled this mountain of needing to help people get healthier by partnering with the churches in our area.
Okay.
Because you have now 2 faith-based institutions
Okay.
combining their resources, and this blended strength came out of this. You have the hospital system with the knowledge and with education, with community resources like screenings, mammograms, that type of thing that they're doing in the community. You have the church family with a built-in support system, with facilities, with knowledge of their community, with a connection to people. What if we put those 2 together?
Okay.
And all these things that the hospital can do and can provide, what if they could do these things and provide these things by working through the church family?
That's right.
So this is what they did. They got a group of ministers together. I think they met for about 18 months with those ministers, said, what would this need to look like? What could we do so that your church family would embrace this and be willing to try this? And they began what Methodists called the Congregational Health Network.
Okay.
Theirs was network, ours is alliance. And so they've been doing that for about 10 years. And they've documented visits, they've documented efforts in each church family, and they've begun to see that with those churches in their Congregational Health Network, they have lower rates of readmission. They have a lot more people getting screenings at appropriate time. They're able to not only address just typical needs, they can look at the communities where those churches exist and what might we know about this community that we can work through the churches. So here's the example of that.
Okay.
At one time, Memphis, and this just breaks my heart to know, but they had the highest infant mortality rate in the nation.
In Memphis?
In the Memphis, Shelby County area. And there was one particular zip code in Memphis where it was extremely high. Well, Methodist Healthcare Systems had a number of churches in that zip code. So they began to use these churches as a group to talk about healthy pregnancies, to talk about the benefits of breastfeeding, to talk about infant care, to get these moms hooked up with WIC and some of those resources that are out there so that they can get the formula and they can get the food that those babies need to thrive. And so over a period of time, they saw those numbers drop by working with churches. So that, for me, I've worked with people one-on-one, I've worked in small groups. But it's like that old adage of walking along the seashore and throwing the starfish back in. But you can only throw one at a time back in, and you see all these others laying, and you're thinking, what good is this doing?
Okay.
Churches can provide the opportunity to impact large groups of people.
Okay.
And so we're excited about beginning to partner with churches in our area, making these resources that we've always made available to the community, but making them available to church families in that environment, kind of the home turf.
Okay.
Yeah, so that's our goal. We just feel like we can change some of the health statistics that we're seeing about our area through church families.
That's wonderful. I really hope and pray that everyone that you encounter, everyone that you present this plan to, they grasp it wholeheartedly. They say, okay, we're going to do this. And even if it's only 5 members at a time, I'm sure that it will grow more and more, as the time goes on, and those numbers will increase. The members, I don't say members, the participant numbers will increase, and then health issues will decrease. Or become more manageable by way of interacting with the Health Alliance and allowing St. Bernard's to provide some tools necessary to carry out what needs to be done. I want to say good morning to Reverend Dr. Greg Ota. I know his church is one that is on board, that is going to be implementing this program. And also to Miss Tanita Boyd Wathel. Good morning, KLK fam in Jonesboro. Good morning to you all. And to everyone else out there that is watching and listening. We thank you for supporting KLK. And I hope that you're taking notes and, making plans to talk to your pastor, church leaders, whoever, to have someone come out and speak to present this information to the congregation. Okay, so we talked about the what and kind of the why. Let's get into how. It says the partnership begins when a congregation's leadership signs an informal agreement with St. Bernard's Healthcare. This step simply expresses the desire to utilize the resources St. Bernard's can provide at no cost. So let's get into the how.
Okay, great. Well, obviously, you want your leadership of a congregation to know what's going on. A lot of times we get our foot in the door with a local congregation or group through a member who's heard about the program.
Okay.
But this is just a formality, a step that says from the top down, we're on board with this. Okay. And as you can imagine, we want the leadership to be an advocate of the program, to be able to encourage their members to participate, for there to just be a buy-in from that leadership. So that little piece of paper, that agreement just says the leadership of a congregation knows what's going on and we're on board with this.
Okay.
Now, we realize that in our area we have 2 major hospitals. And so there's been a little bit of concern sometimes that by signing an agreement, your congregation is making a choice for St. Bernard's over other healthcare institutions in the area, and it's not that at all. It is just that you want to utilize the resources that we can provide. We tell church families, you'll probably have employees at different healthcare institutions throughout the area. As you begin to work these healthcare teams, that's what churches will do as a follow-up step. Let's get a team together who's going to talk about the healthcare needs of our church family. You utilize every resource you have available because it's going to take all those resources.
Yes.
And we love the idea that they can use they can use a St. Bernard's health screening, but they may have a member who works somewhere else that has expertise in exercise. And so they're going to start an exercise class. Or they're going to be able to talk with their seniors about fall prevention and about how to make your home safer. So the whole idea here is let's just get something going, use these resources that we can make available to your church family. Once that's done, we need a key person in that congregation to be a contact. We call that position a liaison.
Okay.
And a liaison is that person in the church family who communicates with me as the navigator about what their church family could use to help them become healthier.
Okay.
On the prevention side, maybe there's a sizable number of folks at Congregation A that are diabetic.
Okay.
So the liaison gets with me and says, you know what, we've got 10 people who would really be interested in a diabetes class.
Okay.
So I say, okay, let's get together, give me some times, we'll get an educator out there to you.
Okay.
See, that's the key that I think makes the difference. We have diabetes classes all the time in our community.
Yes.
But generally, people are going into an unknown environment, meeting with people they don't know. And that can be a little intimidating for a lot of folks. So if we can take a program into a church's facility, you go to that facility, which you're already familiar with, you're meeting with people that you already know,
Yes, ma'am.
probably going to be a lot more likely to attend. And when we get through with the class, you've got a built-in support group. You guys can continue to walk, you can continue to share recipes, you can continue to talk about strategies that you're using to manage your diabetes, and you can carry that beyond the education because there you are all together, already dealing with the same issue.
Yes, ma'am. Most churches have weekly group meetings. Say women's ministry, children's, the men's, whatever the case may be. This is something that could be incorporated into that weekly meeting.
Absolutely.
It could be once per month, okay, or 5 or 10 minutes after, we conduct our business and lesson. Let's talk about, our health, and let's talk about, what's going on with everyone. What are some concerns? And, make note, have, like you said, that liaison, take those detailed notes and then coordinate with the navigator. Here are the needs that have been expressed. What are your suggestions? What are your recommendations? And go from there. This is really appealing to me because I'm a sociologist. I'm studying sociology, and I just finished a research class. And not that I love statistics, but I know that it's important. I now understand the importance of questionnaires and surveys and collecting data and analyzing it so that you can help meet the needs of the individuals. Going back to when you mentioned about the intake form at the hospital, I always wonder why they ask me, do I have a church affiliation? Do I go to church? You often wonder why certain questions are asked, but they are used for statistical purposes to help either create or improve on a pre-existing program.
Well, and that's where you have to look beyond the disease diagnosis. You look at, they call them social determinants of health. And so they're things outside your genetics. And they include education level. Okay. That's a huge social determinant. Housing. Access to food, healthy food. Access to care. Do you have a caregiver at home? Do you live alone? For a lot of seniors, we get into that issue of what is your monthly income? Can you afford your medicines? Things like that. And so what we realize, and this Congregational Health Alliance is under the umbrella of a program at St. Bernard's called Population Health. And population health is where you look at the population as a whole, and that can be done in a variety of ways. We can look at a population of diabetics. So what do diabetics need? What are some things we can provide for those? We could look at a population with another diagnosis like heart disease or COPD. But we can also look at populations in terms of seniors. And this population is our congregations.
Okay.
So how can we look at a congregation as a population and utilize that as a resource to help individual health? Okay. So I love stats too. because stats paint a picture. Let me share one with you that of all the ones that I've read over the previous, 12 years, I guess, this is the one that drives my passion for this work. About a year ago, a university out of Washington, the state of Washington, looked at longevity rates by counties across the United States. Believe it or not, depending on where you live, there is a 20-year difference in the United States in average longevity rates. So in certain part of the country, the average lifespan is 87 years. On the short end of the stick, the average lifespan is 67 years. So my next little point of curiosity is to look at the map and find Arkansas. And I probably don't need to show you the map. That we in the Delta tend to be on the short end of that. Now, we're not, we're about 70, averaging around 70 for our average longevity. But there are 3 counties in the state of Arkansas that are in the top 50 counties in the United States with the shortest lifespan. 2 of them, Poinsett County and Crittenden County, are in St. Bernard's service area.
Can I try to guess one of the others? You said Poinsett, Crittenden. Would it be maybe Lee, Phillips?
You're Phillips.
All right. We're going to have to stop right there. When we come back, we will pick this discussion up and talk more about how this alliance can really help not just individuals, but groups of people, congregations as a whole. So stay tuned, and we'll be right back after these announcements.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
Why is home the hardest place to lead? I'm Mark Merrill with today's Family Minute. It's tough to lead at the office. You have constant HR headaches, cash flow issues, and operational problems, just to name a few. But it's a lot tougher to lead at home. Why? First, you can't fire your children. You're a parent forever, no matter what your children say or do. Second, there is no paid or unpaid time off. You are always on the job, 24/7, doing their laundry, helping with homework, carpooling them to school, practice, and games. Third, there are no salaries, bonuses, or raises. As a parent, you are more like a constant ATM. Remember, your family first.
For more resources on today's topic, go to markmerrill.com.
Family Minute is made possible by the Kappa Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated, a non-profit organization committed to service to all mankind. Kappa Nu Omega Alpha Kappa Alpha on Facebook and KNOMEGA1908.com.
Family Minute is brought to you by the Gears Foundation, a non-profit organization providing students with assistance in their academic and career pursuits. Gears Foundation on Facebook, Gears_Inc. on Instagram, and the Gears Foundation at gmail.com.
Meineke of Jonesboro is now Starks Auto Service, a full-service auto repair and vehicle maintenance center, offering engine and transmission repair, brake service, tires, oil changes, and more, performed by ASE certified mechanics. The all-new Starks Auto Service, 2813 South Caraway Road in Jonesboro, 870-204-7112. Starks Auto Service, Jonesboro.com.
Hey ladies, it's Nettie Jones, the Girlfriend's Therapist. I'm here with my girls, Elise Lyles and Brianna Hill.
The Fab Squad.
Tune in this week for our featured bad woman of color. She's bold,
audacious,
and determined. She's a bad,
shut your mouth,
woman of color. So tune in this week from
10 to 11
right here on KLEK 102.5 FM.
You don't want to miss it. Tell a friend.
Hello, I'm Officer Victoria Evans. I have always had a desire to help others in need and to be an example and role model to young women by encouraging them to never give up on their dreams. My dream was to become a police officer and to serve my community. In 2016, that dream became a reality, and it is the most rewarding experience of my life. Now I want to let you know about the same opportunity. The Jonesboro Police Department will conduct testing every month for patrol officers. Applications are available online at jonesboropolice.com or at the Police Department, 1001 South Caraway Road. The Jonesboro Police Department offers a competitive salary, health, and retirement benefits, top-of-the-line training, and most importantly, the chance to make a difference in the Jonesboro community. Join me in making Jonesboro a better place. The Jonesboro Police Department is an equal opportunity employer, and women and minorities are especially encouraged to apply. More information is available at 870-935-5657.
The Jonesboro Alumni Chapter of Delta Sigma Theta Sorority Incorporated was established on June 28, 1997 by 13 dynamic women who accepted the challenge and honor of chartering the Jonesboro Alumni Chapter. Today, the chapter continues to impact the Jonesboro community by sponsoring programs such as the Sonia D. Williams Scholarship Breakfast, Back to School Bash, Disaster Preparedness, Delta Academy, Empower African Girls, and Autism Awareness. Our focus correlates with the national theme, uncompromising commitment to communities, service, leadership, empowerment. Our chapter supports Delta's 5-point programmatic thrusts: economic development, educational development, international awareness and involvement, physical and mental health, and political awareness and involvement. More information about the Jonesboro Alumni Chapter of Delta Sigma Theta Sorority Incorporated is available at www.jonesboroalumnidst.org or via email jonesboroalumni@live.com.
The Epic Center, located at 1899 Hasbrook Road, County Road 333, is Jonesboro's newest venue for entertainment for the entire family. They offer an auditorium with theater-style seating for up to 1,100 guests, a large stage, professional lighting and sound, dressing rooms, concessions, and more. Available for weddings, concerts, pageants, birthday parties, showers, and more. Booking and other information is available at Epic Center Jonesboro on Facebook, epiccenterjonesboro.com, and at 870-530-5841.
Did you know that KLEK 102.5 FM is a non-profit organization? Did you know that you can donate to KLEK 102.5 FM and your donation is tax deductible? Donations to non-profit organizations such as KLEK can reduce the amount of taxes you may owe the IRS or increase the amount of any potential tax refund. Support your KLEK today. You can donate by calling 870-277-1080, visiting our studio at 1411 Franklin Street in Jonesboro, or on our website www.klekfm.org. We at KLEK 102.5 FM are blessed and grateful for your support.
And now back to Community Conversations on KLEK 102.5 FM.
Welcome back to Community Conversations on KLEK 102.5 FM. I'm your host, Quabila Jones, and my very special guest is Ms. Karan Summitt from St. Bernard's Healthcare. We are talking about the Congregational Health Alliance, and I hope that you've been paying attention during the first part of the show. She gave us some wonderful background information, but we're not done yet, so stay tuned for more information. We're going to address something. When we went to break, we were talking about counties in Arkansas that have a high number of, let's just say, the life expectancy is not very great, where it could be. And we'll get into more of how we can increase those statistics in those areas, and just all across the state of Arkansas, across the United States, period. But we have to start at home first before we can reach out to anyone else. So the one thing I do want to get started with this conversation on is it says this program addresses two distinct areas of health, prevention and follow-up care. So we've talked about, some preventative measures, how this group will help, once it's implemented in a church, individuals can start having these discussions, and then getting people to the doctor, get checkups and whatnot, and diagnosis, and whatever else follows that. But then it comes follow-up care. So let's expound on that.
All right, when we say follow-up care, or aftercare is another term that we're using, we're talking about those people in the congregation whose health has kind of reached a point of more seriousness. Okay. They may have been hospitalized and they're discharged. They may be dealing with a chronic disease that's in advanced stages. Okay. Just anything along those lines. So we're kind of at a different place than prevention. We've already got the disease and the disease is progressing. So there are resources that so many people are not aware exist. Resources to help buy medication, resources for education and management, resources for therapy, even resources to help people get to their doctor's visits or get a doctor, at a cost that they can afford. There are people who need those resources, but they don't know the resources exist. Mm-hmm. St. Bernard's, as a healthcare institution, is got a pretty good inside knowledge of those resources. Mm-hmm. So we realize that often the resources are there, the people who need them are there, but there's no bridge to connect it. So again, it's just almost one of those things, excuse my terminology, that you want to say, duh. Who would be more logical than a church family to be that bridge? Right. Because a church family knows their members in most cases. A church family loves their members. Yes. A church family has more of that day-to-day interaction with them. And so another aspect of this program then, with that liaison, that person in the church family, is when someone is dismissed from the hospital or someone is dealing with a chronic disease, that liaison builds a group of volunteers who maintain some contact with this person. And when that need arises, the liaison gets in touch with me as a navigator and says, Sister so-and-so was dismissed from the hospital. Mm-hmm. She went home with some new prescriptions. But when she called the pharmacy and went to get prescription A filled, the pharmacist said, well, that's going to be $100. Your insurance doesn't cover it, or you've got $100 copay, whatever the situation might be. Well, Sister so-and-so's on a limited income, and $100 means grocery money. It means paying the electric bill, paying the rent bill, whatever. And so a lot of times people do exactly that. They do without the medicine. They let the grocery bill go. They do without food they need to get well, or they get behind on payments. Mm-hmm. We know there are a lot of community resources out there to help people with medications. And so we begin to look at Sister's situation. Maybe she's Medicare eligible, so there's some things that can help people who are on Medicare. Maybe her income level just allows her to qualify for some things that she's not aware are out there, or that drug company has a program to help people on limited income. Maybe we just go back to the doctor. Okay. And we call his office and say, her health insurance, or maybe she shouldn't have any at all, this medication is out of her reach. Is there another one that maybe might be more cost effective for her? Do you have some drug samples? What can we do to help her get the medicine she needs? Okay. Now we'll use that example because that's a pretty common one with a lot of people. Yes. But we've seen situations where they did all of those things that I talked about. They did without the medicine, which then impaired the healing. They weren't able to get back to healing. We've seen some heartbreaking situations where a married couple was living together, and one of the spouses did without the medicines they needed, so the other spouse could have what they needed. So again, our church families can help us build this bridge to meet more of those needs. Obviously, we could never promise to meet every need, but we can look into it. We can try to move forward. We don't want those needs to go unmet when there's the resources already out there.
Yes, ma'am.
That could do that.
I was thinking of another situation, and this is just based on my personal experience. Several years ago, starting in 2010, I started having surgery, on my legs. And yes, for a good portion of the time home, I had home health nurses because I had, wounds that need to be tended to. Well, after a while, they felt that I was at a good point where I was discharged. But there were still times when, I may have some difficulties. And the same with other people who have surgery or some type of major injury. A lot of people are not always prescribed to a rehab hospital. They go straight home. But based on where they live, say they have stairs outside or inside, depending on how their home is shaped, designed, they may have some difficulties getting around. They may need someone every now and then to just come check on them. They may have a step-in tub versus a walk-in shower, or a number of things could, prevent them again from maintaining or
improving.
There you go. I'm sorry. Improving.
Getting back to that state of health that they want to get back to, or at least whatever is the best possible health for them.
Yes.
Yeah. When we, with this program, if someone has this advanced chronic disease, are they discharged from the hospital? And let me back up a little bit, because I think you'll see what we all do. Let's suppose you're in the hospital.
Okay.
And it's discharge day. So here comes your discharge nurse. She's very thorough. She's got a packet, and I'm holding my fingers up about 1.5 inches, 2 inches, distance. And she's asking you all these questions about getting home. Can you get your medicines? Can you make your doctor's appointment? Do you have someone there to watch you? And of course, all of us in the hospital, we have one thing we want to do, which is what?
Go home.
Go home. And so whatever she asks us, we tend to do what? Yes. So we get home. The liaison and that team of volunteers in the church's health ministry will do a follow-up visit with that church member once they've got home. They walk into that home environment, and we have a pretty specific questionnaire. And we've had the discussion with the church family before this all occurs. We talk about confidentiality. That's a very important thing when you're talking about healthcare issues, how these volunteers need to be very, very careful that as they discuss healthcare issues with this individual, that those things remain confidential. They remain private unless the individual's given them permission. So that's a part of the training that we do. There's actual training that goes into this.
Okay.
But on this list, it's kind of a checklist of things. And so you're looking for the things that you talked about. Can you navigate your home? Do you have a way to get back to the doctor? Did you get those meds filled? Do you have a family member? Many folks have family members that kind of pick up the loose ends here, but some people don't. So as they go down that checklist, that's where these needs can arise. The church family may choose to meet some of them. The obvious one that most of our congregations do is if this person needs food brought in for a few days, you've got your church ladies bringing their dishes with their name on the bottom. We love that. We know that good food's coming in, that person's going to be taken care of as far as food. You may have a member who's retired, who's got some flexibility in their schedule, and they're the one that you can call if somebody needs a ride to get to the doctor's appointment.
Okay.
So again, we want church families to continue doing what you're already doing to take care of your members. We want to fill in those gaps.
Okay.
But first we've got to identify those gaps.
Yes, ma'am.
And when you get in that person's home, you see a whole different picture of what life might be for them outside of just calling them or visiting them in the hospital.
Yes.
And if a person, maybe they've had a fall, so they've got a broken bone and they're needing to use a walker when they're home. We have sources that can help supply DMEs, for people.
Okay.
If they can't afford a walker, if they need one of the bath chairs because they can't get up and down, we can do some training so that church member can look at the home environment. If you've got a walker, you might need to get rid of some rugs, throw rugs. You might need to clear some of the little whatnots and things out of the way so this person has a good wide path to get around in their house without that walker or their leg or something catching. You know, we get home and we tend to think, well, I'm in my house, I'm not going to worry with that walker.
Yes.
Yep. We could just talk about tons of little things like this, but I think you're getting the picture of how the church family becomes this valuable asset if we take the next step beyond call me if you need me kind of thing.
Oh my gosh, yes. Yes. And I understand everyone has a life. People have their own individual responsibilities, obligations to their family, their job or whatnot. But I think if we take just 5-10 extra minutes, you know, or on your day off, really go and check on people. And I say that, I want to say that to the whole community, not just churches, just the whole community. Mm-hmm. If you've built a relationship with someone, take time to really go check on them. And I'm bad about it sometimes, and I have to check myself on this. I don't call and text or whatever often, or I will text versus calling. Simply, I don't want to be on the phone for an hour. I have, you know,
have a little more control with that.
I feel that we all can take a step back and reevaluate and readjust our lives to say, okay, we have become disconnected on some levels, and we need to find a way to become a community again.
And you think again, you know, there's so many layers to this program, because if you have a health ministry in your church family, and what I mean by a health ministry is a ministry on one hand where we're doing the prevention, we're learning how to take better care of our body. On the other hand, we're doing the aftercare. We're learning how to take care of each other when those health issues arise. Look at what an opportunity that is for so many of your members to use their vocation to serve their church family. So maybe they're nurses, maybe they're CNAs, maybe they, we call them gym rats. You know, maybe they love exercise and they like activity and they can do something to, you know, build some fun exercise, physical activity programs for their church family. Maybe you've got somebody who loves to cook, and the challenge for her would be to be testing and trying some healthier recipes that she shares with the church family. So people begin to use what they're already doing, but they use it as their ministry within their church. Now, the other part of this that you talked about a while ago was the good intentions that we all have. With the structured program on the aftercare side, the liaison calls a volunteer and says, do you have time to go see the sister we talked about a while ago that was dismissed from the hospital? That form that they take has some built-in accountability. Now, I don't know about you, but I need accountability in my life, or those good intentions are always there, but I never follow through on them. So the person who is part of the ministry takes the form, goes to see the person dismissed, and then they return that form to the liaison. And that's just human nature. We do better when someone gives us some accountability, says, I need to hear from you by such and such date. I need you to go see this and fill this out and bring it back to me. And then, man, we get on the stick about that. But that's okay. That's okay. That builds a good program when there's accountability built in.
Yes, ma'am. And I think when the liaison or whoever else has been assigned to check on someone, just really follow up with individuals, you're building a relationship, and you're building the relationship that Christ wanted us to build. And you know, we're not going to get into a sermon today, but I mean, look at what the church is designed. It was designed for. Absolutely.
And you think about, and this is probably a good place as we begin to kind of wrap up this conversation. We mentioned at the very beginning, we're going to kind of bookend this. We mentioned at the very beginning that most healthcare institutions grew out of hospitals. That's why we have Methodist healthcare system in Memphis. Grew out of churches. That's why we have St. Bernard's. That's why we have NEA Baptist. They grew out of the church's fundamental understanding that we are to take care of the sick. That's part of our job. So we're bringing it full circle almost.
Yes, ma'am.
Because we are commissioned to care for each other. And we care for each other not just for physical needs. We care for each other with emotional needs and mental needs. But those things don't exist in isolation from each other. So if someone does get physically sick, or if someone's health begins to deteriorate, that can become a spiritual issue. That can become an emotional issue also.
Yes.
And this type of program, the Congregational Health Alliance, is really bringing all of those aspects of a healthy body together, back together again. And when it's done through the church family, we can address the spiritual needs, we can address the physical needs, we can address the emotional needs.
Because when someone's going through something alone, you know, I can't speak for everyone, but sometimes the last thing they want to do is pray or, you know, reflect on something spiritual. They're only focused on that physical thing that's happening or that has happened to them, and how am I going to get through this or get around it or whatever. They're focused on that, and so their spiritual life suffers, you know, gets ignored. And so yes, if they were part of a group that was constantly there, interacting with them, checking on them, keeping them accountable for what they're responsible for, it kind of builds and lifts the person back up.
Yes. When we kind of introduced this program to the community in February, a gentleman from Memphis who'd been a part of that Memphis program for all 10 years, he's a pastor. He came and he spoke about the impact that it had had on his congregation. And we brought him because we wanted him to give a vision to our people about where this thing could end up. And so he had all these examples of just what it had done for his own church family. And one of the things that impacted us the most was how he encourages his church family in terms of personal health. And he said, you know, we're all here for a purpose. God put us here for a purpose. Our body is the vessel that we walk around with every day that allows us to fulfill that purpose. So taking care of our physical health is in a way taking care of that purpose and allowing us to live out that purpose that we're here for to begin with. So his congregation, they had a spare room. He told people, he said, you know what, if you've got any exercise equipment at home that's collecting clothes, you bring them down here, and then anybody that wants to can come to the church and exercise right here at the church. And so they even have groups that meet together, you know, same time every day. Let's go get on the treadmill, the stationary bike, whatever. They have little weight loss competitions. I got on their website and just looked at some of the neat things they do. So they make it fellowship activities as well as meeting more serious needs.
That's wonderful. We have a Facebook comment as we get ready for another break. Want to give a shout out also to Miss Kimberly Locke Thomas. She gives a thumbs up, and Miss Tanita a thumbs up. So I'm guessing they really, you know, were agreeing with some things we said. And Miss Helen Scott says it's another version of tithing. I never thought about it like that. And I had this discussion with someone else about tithing. It goes beyond the money, giving of your money, and that's a whole other conversation within
it's
itself.
giving of your heart.
Yes. So I would love to see this community be even better. Jonesboro is a great community, but there's so much more that we can do. When we come back from our break, the last segment is very short, but I want to touch on the food deserts and other aspects of how this program incorporates just all of those different avenues. Okay. All right, so you're tuned into Community Conversations, and we'll be right back after these announcements.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
We're back with Money Matters. I'm Alfred Edmond Jr. Money issues have long been cited as the most common characteristic of failed marriages and other relationships. But it does not have to be that way. Black Enterprise Senior Personal Finance Editor Stacey Tisdale offers the following advice for couples who want to overcome and avoid differences when it comes to managing their money. Set long and short-term goals as a couple. Stay connected to your goals by having a monthly money date. Attach a positive activity to it, like dinner, and be sure to talk about your goals and dreams, not just your problems. Figure out how to build on each other's strengths. Note, do not have this meeting at the beginning or end of the month, as things tend to be tense near bill paying time. I'm out of time, but tune in for Money Matters tomorrow for more tips to keep you and your mate from being divided over money issues. I'm Alfred Edmond Jr. for Money Matters, a product of American Urban Radio Networks.
Money Matters is made possible by the Jonesboro Alumni Chapter of Delta Sigma Theta Sorority Incorporated, a nonprofit organization dedicated to uncompromising commitment to communities, service, leadership, empowerment. www.jonesboroalumnidst.org.
Money Matters is brought to you by Bancorp South, offering checking, savings, loans, credit cards, and wealth management. 5 locations in Jonesboro to serve you. www.bancorpsouth.com or 870-972-9800.
Money Matters is brought to you by the Gears Foundation, a nonprofit organization providing students with assistance in their academic and career pursuits. Gears Foundation on Facebook, Gears_Inc. on Instagram, and the Gears Foundation at gmail.com.
Danny Ford, owner of Glen Saint Motors in Paragould, strongly believes in the values of family and hard work with a commitment to the men and women of the U.S. Armed Forces who keep America free, providing sales and servicing of Chevys, GMCs, Buicks, and Cadillacs, located at 6345 Highway 49 in Paragould. 870-565-4358. Details at glensaintparagould.com and at klekfm.org. God bless our troops.
KLEK thanks CJ Pepper and the staff of Life Strategies Counseling Incorporated for helping people through hard times in life such as depression, family issues, stress, abuse, and more. They offer counseling and therapy for all ages, individuals, families, and groups. They are located at 1217 Stone Street. Phone number 1-866-972-1268 or online at lscihelp.com.
Teresa Beck, owner of Full Sun Gifts, 606 Southwest Drive in Jonesboro, is a proud supporter of KLEK. Full Sun Gifts offers a variety of gift ideas such as candles, fragrances, bath and body products, makeup, cosmetics, skincare, and more for birthdays, weddings, holidays, and all occasions. Details at Full Sun Gifts on Facebook and Instagram and 870-974-8480.
The Mu Omicron Lambda chapter of Alpha Phi Alpha Fraternity Incorporated was established on January 1st, 1977, originally serving Blytheville, Arkansas, and now serving Jonesboro, Blytheville, Osceola, Marion, and West Memphis, Arkansas. Today, the chapter continues to make an impact by focusing on Alpha's national community outreach initiatives such as My Brother's Keeper, A Voteless People is a Hopeless People, Go to High School, Go to College, Project Alpha, Boy Scouts, and the March of Dimes. The Mu Omicron Lambda chapter of Alpha Phi Alpha Fraternity Incorporated is committed to Alpha's mission of developing leaders, promoting brotherhood and academic excellence, while providing service and advocacy to the community. More information about the Mu Omicron Lambda chapter of Alpha Phi Alpha Fraternity Incorporated is available at MOL Alphas on Facebook or via email at molalphas@gmail.com.
The McDaniel Law Firm, 400 South Main Street in Jonesboro, is a firm believer in justice and equality for the minority community. The McDaniel Law Firm has fought for our rights for over 44 years. The McDaniel Law Firm offers legal help for wrongful death as well as trucking and automobile accidents. Bobby and Brett McDaniel are available for a free consultation at 870-336-4747 or at www.mcdaniellawyers.com. Check out Melvin Williams of the Williams Brothers every Sunday morning from 5 to 7 a.m. here on KLEK for the Melvin Williams Down Home Gospel Radio Show, playing the very best in quartet and inspirational gospel music that you'll love, as well as feature interviews with all of your favorite gospel artists. It's Melvin Williams Down Home Gospel Radio Show, Sundays from 5 to 7 a.m. on KLEK 102.5 FM.
And now back to Community Conversations on KLEK 102.5 FM.
All right, welcome back to Community Conversations on KLEK 102.5 FM. I am going to let Miss Karen have the final moments and share some information that we may not have covered, and give her contact information. Okay?
Hey, well, let's see. Where were we talking on the break? I think let me start with, I guess last thing I remember was we talked about communities. Yes. And we talked about the health challenges. Way back in the conversation, we talked about our area having those shorter longevity rates, lifespan being a little bit shorter. Well, that's tied right into the chronic disease issues that we see. So we have high rates of obesity, high rates of diabetes, high rates of heart disease, and obviously those things are going to impact lifespan. That tends to happen because people in our area fall into two extremes. Either they have too much. They have too much time, they have too much money, they have too much access to resources, great jobs, great lifestyles. Sometimes bring around a lot of eating out. They bring around jobs that have you sitting all day and a lot of stress, and those things can impact your health, just like not having enough can. Yes. And so other groups of people in our community, they don't have access to resources, they don't have the health insurance they need, they don't have the education they need. They live in a food desert. And a food desert is just those pockets of places, and we have them right here in Jonesboro, where people don't have access to healthy foods. Yes. And so they may not have transportation. The closest thing is the mom and pop convenience store. Yes. And I don't know about you, but I don't see too many bananas and apples in convenience stores, on the corner. And if they do, they're generally priced quite a bit higher than they would be at the grocery store. Yes, and so things like that happen that make it very challenging. And what the church family can do is help people build an environment where they can have access again, they can have support, they can help people rethink their lifestyle. So if I've got a sit-down job, what can I do to be more active, even in my work day? Okay. Making more trips to the trash instead of left out. Yeah. There's a lot of different things that you can do. We can definitely do a whole other show of how to incorporate more physical activity into your daily life. Actually, May is National Physical Activity and Sports Record Awareness Month, so I'm looking for someone to come and talk about, incorporating that. I want to make sure to give your contact information before we run out of time here. So how can people get in touch with you if they want to start implementing this program? Well, let me give you a quick phone number, 207-7487. 207-7487 is my direct line. If I'm not there, I have a voicemail, so please leave a message. I'll get back in touch with you. If you do emails, K as in kitten, Summitt, SUMMITT, 2 M's and 2 T's, at sbrmc.org, St. Bernard's Medical Center.org, sbrmc.org. And so obviously I'll reply to that also. I'll leave my information here at the station so y'all can pass that on if you need to. But what we would be happy to do is come and speak to your congregation. You may want to start with your ministers or your leadership. You may want to start with your ladies group. One of the things we haven't touched on is this is a program that really is for the lay people in the congregation. It's not something to add to the work that your pastors and your ministers are already doing. We want them to be advocates, but it's going to need a lot of people in the congregation on board, and it's a great way, again, for average members to plug in and find some ways to use their talents. That's awesome. Everyone has a role to play. Everyone is valuable in the congregation, so there's something for everyone. So consider bringing this to your pastor, like she said, and implementing this program in your church. We will definitely have you back within a few months to follow up and go over statistics. Look and see how many people have implemented and what has been some of the progress reports submitted to you. So great. Looking forward to it. Thanks for having me today. Well, thank you. And thank you everyone for tuning in and sharing. This has been your Friday edition of Community Conversations on KLEK 102.5 FM. Have a great weekend, everybody.
Thank you for listening to Community Conversations on KLEK 102.5 FM, a program focusing on the people working to make the Jonesboro community a better place while